My name is Reyna Robles. I'm 41 years old and I live in San Jose, California. I'm a mom of 4 active kids. I work full time. All of a sudden I noticed during one of my workouts I'd get chest pain, and I thought I'd better go to my doctor and get this checked out because that isn't normal. So I went to my doctor, had an EKG that came back normal, but the chest pain persisted. So my doctor referred me to many other specialists. Those specialists ran their tests. Tests would come back normal, and I was continually told that my heart was fine. But at this point I noticed that the chest pain was progressing. It was affecting me more than during my workouts. Sometimes it was a struggle just to get from the driveway to the house. And once I made it in the house, I would just sit in my chair 45 minutes or an hour until the episode went away and I was able to move some again. So after I wound up in the hospital, they referred me to Stanford Women's Cardiovascular Clinic. I saw Dr. Tremmel, and my life was never the same.
Nice to see you again.
The great thing about Dr. Tremmel is that she listened. She explained that women present differently than men when it comes to cardiovascular issues and symptoms.
They often have a lot of other symptoms that they come in with, so maybe more shortness of breath or more fatigue. Their pain may be in kind of different spots. And women who have maybe normal appearing coronary arteries on an angiogram, their stress test may not show a problem because maybe they're not having full thickness of their myocardium, not getting enough blood flow, but in fact maybe just a little bit of the heart muscle is not getting enough blood flow. If you need one during the day, it's fine. We did all this extra testing, and indeed she had some endothelial dysfunction, and she had endothelial dysfunction within a bridge, so we saw a myocardial bridge.
The myocardial bridge is where my heart muscle grew over an artery, and it was squeezing or compressing on an artery. Dr. Tremmel took the time to explain that it takes lifestyle changes and finding the right combination of medicines. I took my medications as prescribed, but regardless, the symptoms continued.
We did see these physiologic changes, and that really gave us great confidence to say, yeah, this bridge seems to be the problem. We've tried everything else, and we think it's worthwhile going through surgery. Looks great.
I'm only 3 weeks out of the surgery, and yesterday I went for a follow-up to see Dr. Tremmel, and it was amazing how much better I felt. Those regular episodes of tightness and pressure that would debilitate me are for the most part gone. Thank goodness I was under the care of a wonderful cardiologist who was able to see that, yes, that isn't normal and we're going to figure this out. I trust Stanford.
Stanford has a long-standing history of really paying attention to physiology inside the coronary arteries, and I think that's something that we pride ourselves on doing and taking the time to really figure out what's going on here.
I want women to know that if you experience ongoing chest pain or symptoms that you feel are cardiac in nature, see a cardiologist who specializes in women's cardiovascular health. That will make all the difference in the world.